you learn nothing else from me, is that this is not the time for decline. Absolutely not. This is the time to put yourself first, to prioritize your own health and wellness, to really sit with yourself and go, what do I really want? What's up, guys? Dr. Nicole here from Antigravity Wellness, the Women's Hormone, Perimenopause, Menopause Clinic, Menopause Board Certified, Washington, Oregon, and now Idaho as well. So I actually just got back from Idaho. We went over there for a wedding and it was so fun. A very country wedding. Just left it. The bride rode up on a white horse. It was just about the most beautiful thing I've ever seen in my entire life. It was crazy. Really fun to get out of town. And then I had some downtime by myself in the hotel room on Saturday because my husband was actually in the wedding and I didn't really know anybody. So I took the advantage of it and I just hung out in the hotel room. I contemplated going out and going to a cafe, working on the book and everything. And I was like, you know what do I really need? So I had that moment of what does Nicole need right now? I was like, well, first of all, I need a nap. So I took a nap and then I had lunch, which was leftovers from a meal we had before because the food portions are just ginormous. And then I watched a little bit of a show. I did some in hotel room spa treatment type stuff. I did a face mask, I did some eye masks, and then I did feet and everything, and then just kind of got ready. And then I sat there and I worked on the next chapter in my book that I'm finishing editing. So the book is written, it is done. I'm just going through and doing final edits. The book is called You're Not Crazy. It is all about midlife, perimenopause, women's health and wellness during this time, and how to really take charge of your hormones and what's going on with your body through this time, so you can be the healthiest version of you now and in the future. And it's all about empowerment. So many women, side stories here, I'm going to get distracted. Okay. So many women, they hit their 40s or even start getting into the late 30s, are like, oh my God, 40 is right around the corner. And then after 40, it's 50. And then after that, it's we're just downhill from there. And then we're old. I do not feel like I'm in my 40s, by the way. I am mid 40s. I'm going to be 45 in November. I don't feel that way at all. What is this? And some good things that are happening is things like, I was just commenting to my physical therapist, Dr. Desiree Lyle over at Raise Bar Physical Therapy. Love her. And no, I referred myself to her because I was having some hip issues at the beginning of the year. Those are pretty much completely resolved. Figured out it's actually the chair that I've been sitting in, and I was sitting too much. So that's common as we age. We stop moving as much as we should be. So tracking your steps is a really good idea. Getting at least 7,000 to 8,000 steps per day. 10,000 is great. More than that, diminishing returns. You should be looking at other things like strength training. Anyways, I digress. It's just going to happen. But my knees actually feel better in my 40s than they did in my 30s. So my whole takeaway from this book, if you learn nothing else from me, is that this is not the time for decline. Absolutely not. This is the time to put yourself first, to prioritize your own health and wellness, to really sit with yourself and go, what do I really want? How do I really want to feel? How do I want to move through my day? How do I want my body to feel? And then take charge of that. You have so much ability to change the trajectory of your life, of your body, of your mind, of your hormones. You have so much capability. Your body wants to heal. Your body wants to be balanced. All you need is the right information. And that's what this book is all about. So the book is coming out soon. I don't have an exact date yet. I am self-publishing, so it's going to be on Kindle. I'm also going to go to a separate publisher so that I can get into bookstores, because bookstores don't really like Amazon because Amazon stole a lot of business for them. So we're going to publish it 2 separate places. Yes, I'm doing an audiobook. It will be available in paperback and hard copy and Kindle. We're doing all the things. Okay. So I'm really excited about that. This week I actually have an appointment to go look at a venue for the book launch party, which we are anticipating around October or so. That's more just to give me a hard date. I don't think that it's necessarily going to take me that long to finish this book. I just need to like sit down and prioritize it. So there's a lot of, self-limiting beliefs and, is it good enough? At some point, I'm just gonna have to call it, right? Just say, it's good enough, Nicole. And I can always go back and make edits later. Like if there's some typo or something like that, or if there's something that I was like, oh my God, I didn't talk about that. I need to put a paragraph in about that at least. But at the same time, also, I can write another book. All right. So this is my first one. And so I'm putting a lot of pressure on it. Just let it go. Early feedback has been really great. It's doing exactly what I hope it would do. It's giving women information, empowerment, and that feeling like, oh my gosh, this isn't hopeless. I have so much ability to make changes. And also letting them know that those crazy symptoms that no one seemed to be able to explain to you, there's a reason for those. There is something that's actually going on there and you're not making it up. And yes, it probably is related to perimenopause because those hormones affect your entire system. Estrogen receptors are all over the body. Progesterone is not just for the uterus, it's for the brain. Okay, it has to do with your sleep. It has to do with your mood. It has to do with balancing the estrogen effects. And estrogen's great. We love her, but man, she can make us crazy. Okay. So the progesterone is the calming one. It comes down and chills everything out. And yes, it has a huge role in the uterus. I like to say estrogen grows the grass, progesterone cuts the grass. Okay, so it controls the growth, especially in the uterus. So that's very, very important, especially for those women who still have a uterus. If we put you on estrogen, you must have uterine protection with progesterone. Oral progesterone is the best form of protection for the uterus. The most studies have been done on that. Topical progesterone does not absorb the same way, does not get into circulation the same way, and we can't say for sure that it protects the uterus the same way. So taking oral progesterone is the best. There are some cases where some women are very sensitive to hormones and they may not tolerate progesterone. Those are special cases, very rare, but it does happen. I actually have a patient that had that happen. Thankfully, she doesn't have a uterus, so we don't have to find a different form for her. We just have to do different things to help her with things like her sleep and anxiety and her stress. So more focusing on things like adrenal adaptogens, like ashwagandha is great, but don't overdo it because it can also just flatten you out. And some people have GI issues with ashwagandha, so make a note of that if you have a sensitive stomach. All right, so I just came back from vacation. I've got an inner circle within the practice of renamed it Women's Total Transformation Program. And we do regular, I have a huge bank for them as far as from beginner to all the way through how to work through your total body transformation in midlife and beyond. And then we do bonuses. So whenever I feel like it, I just get on and do a video or an audio or drop them a resource or whatever, and then they get lifetime access. So that's within our programs at Antigravity Wellness. So if that's something you're interested in, DM us or send me an email at Dr. Nicole Smith at antigravitywellness.com. And we'll put that, or go link in bio, all the places you can find me. Just reach out if you have any questions about the practice and what we do. We do so much more than what I could possibly put on a page. So I don't want to confuse people too, and be like, this is too much. But basically, we help you with your hormones, and we take a very functional medicine approach. I take a very functional medicine approach as far as investigating what's going on underneath. We don't just throw hormones at somebody without going, what's actually causing this? It's not always just perimenopause, by the way. So that's a really great question that I see a lot on the Facebook group pages for perimenopause and menopause. It's come up a couple times now. MIDI Health is one of those out there, that telemedicine clinic that's for hormones, and they don't test hormones. They don't look at hormones at all. They don't even, from what I've seen from people, I'm not a patient of theirs, so I don't know for sure, but from what patients have said on the Facebook pages is they just put them on hormones. They don't even run any labs at all. Maybe like some basic like CBC, CMP, which your primary care can do too. Like that's nothing special. My issue with this, to say that, oh, we only do it by symptoms. It's missing a big piece of the puzzle. And those patients have come to me, so I've seen this firsthand, of where they were put on hormones and some things got better, but they weren't fully better. And then they come to me and they're like, well, I think I still need this. I think it's still my hormones. And it's like, okay, well, let's look and see. And then we take a deeper dive and we find, oh, okay, so she's got chronic adrenal adaptation. Her cortisol pattern is crap. It's not where it's supposed to be. Her vitamin D is way too low. That's going to affect your immune function, your ability to generate hormones, things like testosterone. If you have low vitamin D, your testosterone is likely going to be very low as well. We need it for testosterone production. Also for brain function, also for long-term bone health. Super, super important. We need enough vitamin D. And then adequate calcium intake, zinc, magnesium, calcium, all those things. And your iron stores. So her iron stores were super low as well. And she was like, yeah, I'm still tired. I was like, yeah, you're going to be tired. Even though she wasn't technically anemic, you can have low iron stores, low ferritin for years and be symptomatic, but you're not anemic. And if no one's really looking at this and looking at the functional ranges, because you can be within the normal, which is a ginormous range for Western medicine, on the lab values they're going to get back from the lab core, whatever, inner path, whatever it is. But for a functional standpoint, for things like hair loss and muscle cramps and heavy periods, low iron can cause heavy periods. And then heavy periods cause lower iron, and it's a cycle downward. So as your hormones are changing, as your estrogen's getting higher in relation to your progesterone, because progesterone drops before estrogen, typically in perimenopause. So that's like stage 1, early perimenopause, progesterone starts dropping. Your periods can get heavier. You're going to have more clots, more cramps, breast tenderness, sleep is crap, anxiety goes up. It's progesterone. And then it's your estrogen in relation to that. So these things can cause that to be worse. And then underlying that, now your iron stores are dropping. Low iron causes heavy bleeding. Heavy bleeding causes low iron. It's this cycle that goes down and down and down. And there's physiologic reasons behind this, why this occurs, because it seems like, why would the body do that? But there is a pattern that develops there. So these are all the things that she needed to do in order to actually feel better. And it was going to take months. And that's the thing about functional medicine too. That's the way that we practice here. I'm going after root causes. This is not a quick fix, guys. This is not like, oh, I snap my fingers, I give you a GLP-1 and you're cured. Like, it doesn't work like that. How many years have you been doing what you're doing? How long did it take you to put on that 35 pounds? It didn't just show up overnight. It did not. It took time, and it took habits and routines that created that outcome. Now we have to rewire that to create habits and routines to create a different outcome. It's going to take time. And especially those underlying things like iron repletion can take 6 months to a year. Because the more that we try and replete the iron, the body actually goes, oh, too much iron is bad. It's a heavy metal. It's a heavy metal, but we need it. But we don't want too much of it. And if there's inflammation in the body, it just complicates things. So it increases this thing called hepcidin. Hepcidin will actually block the absorption of iron. So then the more we give, the higher the hepcidin gets, the more it's blocked. So then we have to play this dance here. Oh my gosh. And then trying to get IV iron infusion outpatient is just a freaking nightmare. I had such a hard time with that. I might actually start offering that in my practice just to make it easier access. It's so ridiculous. But oral iron is going to have that problem. So we want to make sure we're getting it from good food sources. Red meat, yes, is a good food source of iron. Women should actually be eating more red meat, but trimming the fat. We don't need all that saturated fat, and that can be a problem for us. But having a few more servings of red meat is such a huge, dense source of iron. It's such a good source of iron. So those women who are eating only chicken and fish are really missing out on that. So if you're tired, your hair's falling out, and you're having these issues, get your iron levels checked. Get your total iron checked, get your anemia panel done, and get your ferritin checked. Ferritin is a separate order from your regular CBC, from your regular iron deficiency panel. Like, I don't know why, but it's just separate from what I found on any of the panels that I've ordered. So those things are really important. So do we need to check labs in order to start hormones? In my practice, absolutely. I test, I don't guess. Okay. I do a very thorough intake. We spend at least an hour together going over everything that could be possibly contributing to what's been going on, your full history. We do a very comprehensive blood panel, and also do a Dutch urine test, dried urine test. And that will look at the metabolism of things like your sex hormones, looking at how well your liver is functioning. Okay. That's very important, because you can have normal levels but still be symptomatic, because if you're not detoxifying, it's just building up in your system and causing problems. And we also look at your cortisol pattern, not just a 1 point in blood test, which I do use to validate the urine test, but or salivary tests. We do urine or salivary testing of a diurnal cortisol pattern, which means the pattern that we should see during the day. So we need cortisol to live. If you don't have any cortisol, you die. Okay. It's absolutely necessary, but we don't want too much or too little. Like, it's the Goldilocks thing, right? A lot of us have chronic stress anyhow. And then you add perimenopause on top of that. It's a stressful situation for the body that is trying to get used to. And if we're not listening to our bodies, if we're not going, oh, I need rest, and you just power through because that's what you have to do, it's just going to make it worse. I have a lot of women who come to me with that complaint. I tried to power through it and I just can't power through like I used to. Yeah. I know. Same boat, okay? By the way, I get it. So it's really important to listen to your body and give it what it needs. I'm doing that today. I'm practicing that today. I am on day 4 of my period, and day 3 to 4. And anybody else notice how, like, your symptoms have changed? Just, I don't know, 4 years ago, 5 years ago, cramps used to be at the beginning of my period, and now cramps are at the end. Like, why? So usually it's day 3 or 4 that's kind of rough for me, and I'm like, I need the heating pad and just to relax. I'm not one of those that can exercise helps. No, it makes it much worse for me. Now I'm the opposite. So I'm actually, I did what I could this morning in my workout, but the more I moved around, the more my uterus was like, I don't think so. I'm not doing this today. So it just kind of got a little bit worse. And I tried to do some home remedy stuff. So this is Thermo Gel from Curve Appeal, which is one of my friends here in Tri-Cities. She's over in Kennewick. Aaliyah has this, and she has her own little med spa, and she does the 3D lipo stuff on the legs. Amazing results on my legs, by the way. I didn't necessarily lose any inches or anything like that. I think that's probably because I have more muscle on me, but some people do experience that would actually lose a little bit of body fat there doing those treatments. But the big thing that happened for me was the cellulite, which was incredible. Even just off the first treatment, I used to run my hand down my leg and it felt like a little washboard. And that's that fascia that gets like really bound up, and that's where that cellulite comes up through and kind of gets like bubbly. And it is what it is. Like, I don't love it on me. And even when I was really lean, it would still kind of come through. But doing those treatments, it seemed to break up that fascia and smooth things out, which was incredible. So I need to go back and do more treatments. And actually I did like 3 treatments and it lasted a really long time. Probably to hurt us me. But this is really cool because this is a Thermo Lipo Gel. Now, this isn't going to make you lose body fat, okay? But it's like a heating gel. There's like arnica and stuff in it. Methyl camphor, and some other things I can't pronounce right now. But I have looked up all of these ingredients, and they're like all natural and all that kind of stuff. So, and I have my wrap on right now. So we've got that, and then this plastic wrap, and then I have one of those compression wraps. So it just feels nice. So it has been helping. It provides some compression, provides some heat, also helps with that water retention. And that's really what this stuff does. It's a temporary thing. It will temporarily like kind of help slim, just because it's helping to get rid of a little bit of puffiness just in that peripheral tissue. So that's never a bad thing. Don't hate it. But it definitely helps. So I know I don't use this every single day, and so it's just like no point for me, but I do like to use it sometimes during my cycle, especially if I'm like, I really want to walk. I don't want to have to sit on the couch all day with a heating pad. So I'll put this on. So it provides that heat, it provides compression, and it just helps with the cramps. It feels a little bit better. So that's a little non-pharmacologic thing that you can do. Nobody hates my doll, right? I can always come in handy. But I'm just listening to my body today. I am going, okay, so I did what I could. I wanted to be consistent with just, my routine. I did physical therapy yesterday, so that wasn't super strenuous, but I still did some work. Today I did, what I could with my upper body until my cramps were like, nope, these aren't getting better. They're actually kind of getting a little bit worse. So now I'm just going to sit in the hot box for a little bit. And then we'll go for an easy walk, do some work on the treadmill. I've got some appointments this afternoon, so I'm just going to take it easy, listen to my body, drink lots of water. Water is a diuretic. You notice that when you drink water, you pee more. And that's not a bad thing. It's cleaning out the system. So we want to be drinking lots of water, especially when we're not feeling well. So I've had a couple patients that have been sick recently. You just want to more water, more tea, sipping on these things all day just to help flush out the body. And then coming back from vacation, I had all of my food. I was already pre-prepped. It was in the freezer, so we just pulled it out. And my husband mowed the lawn and did some yard work before we left. So we took our sweet time coming back, and it was so nice. And now, here we are. It's Tuesday, and I'm chill and relaxed because we prepped ourselves for this. So that's a tip for you guys that are traveling. If you meal prep or think about maybe starting meal prepping, double prep like 2 weeks before you leave. Freeze the meal, so when you come back, you just pull stuff out of the freezer and you're good to go for the week. You don't have to freaking worry about it. You don't have to get it home early. Like, I gotta make food. We gotta go grocery shopping. Clean the house before, mow the lawn, and do your meal prep before you leave for your vacation. And then it's just gravy, And then you don't need a vacation from your vacation because, you can come back home and take a nap instead of running around like crazy. So just setting yourself up for success, thinking about what you need in the future. And then again, listening to your body and come back. How are you feeling? Are you tired? Okay, then take some more downtime. It's okay. You're not going to lose anything by resting. You're going to actually gain more because when you push through, you increase your risk for injury and you increase your stress on your body, your inflammation, your cortisol levels, and that will increase your lipids. It will increase your insulin resistance and it will increase your belly fat and just feeling like garbage. Nobody wants that. Nobody wants that. So listen to your body. Plan ahead, and you're going to be in a totally different situation. It's going to be amazing. All right, guys. So I hope this was helpful. Always reach out to me if you have any questions about perimenopause or menopause or, weightlifting, strength training. We're going to start talking more about that, and diet, nutrition, gut health, adrenals, thyroids, of course, your sex hormones. What about testosterone? We'll talk about testosterone too. Ask me your questions. I want to know what you guys are struggling with. I'm here for you. And if you live in Washington, Oregon, or Idaho, and you want a hormone specialist on your team, I am taking new patients. So you can check us out over at antigravitywellness.com, go to the services pages, and you can take the readiness questionnaire to see if you qualify. We do have a list of our services that we offer there. We have telemedicine as our primary service that we have for the Hormone Functional Medicine Clinic. We also have an in-person practice in Kennewick, Washington, where I do Botox, both for aesthetic and for pain, like tension headaches and migraines, filler, facial filler, lip filler, for, like rebalancing and reclaiming some of that youthfulness and just feeling better in your skin. There is nothing wrong with that, by the way. And you do not have to, I'm going to go off on a little bit of a tangent here. It's your body, and you do what you feel comfortable with, and it's okay either way. Either way. Either you get Botox and you love the results and you're happy with it, or you never have anyone touch you with a needle and you love your results and you're happy with it. And you get to age the way that you want to. That is the beautiful thing about this. It's all about feeling good in your skin, in your body, in whatever way that is. And no one gets to say a goddamn thing about it, okay? Nobody's opinion matters but yours, okay? It's all okay. You can't mess it up. You can't mess it up. And then we also do body composition via ultrasound and body measurements and things like that, because the most important thing, especially as we age, is not the weight on the scale. It's not even necessarily the size in your clothes. It is what your actual body fat percent is and your lean mass. That is the most important thing. We want the most lean mass we can for as long as we can, and we want to continue to build that, because what builds muscle builds bone and builds your metabolism and decreases your insulin resistance and decreases your lipid panel, decreases your heart disease risk, decreases your risk for cancer. All of these things are super, super important. Muscle is medicine. And then we want to make sure that we're decreasing body fat to a healthy level, especially visceral body fat, which is that central body fat. That is metabolically active and is linked to higher risk for metabolic disease, heart disease, stroke, diabetes, all of those things. Okay. So we do body composition because it's very, very important. And it's not just like, here's your scan, good luck. No, it's like, you have a visit with me. So guess what? We're going to talk. I'm going to teach you all the things that I can in such a short window of time, and then give you a protocol to follow. So, all right, guys, I hope you're having a wonderful Tuesday, wonderful start to your week, and I will catch you on the next video. Bye.